I'm Andreas Schibber. I'm a pediatric intensive care specialist. I've been involved in research for more than 30 years, mainly in the field of respiratory care of children.
I'm Donna Franklin. I'm a nursing background, children's intensive care nursing background, and I am employed under the Gold Coast University Hospital as a pediatric research fellow.
So Paris 1 was a research study where we tried to understand better how we can improve oxygen delivery to children less than 1 year of age who are suffering from bronchiolitis. Bronchiolitis is a very common respiratory disease in the little ones, and they present to hospital with difficulties to breathe. They breathe very rapidly, they need oxygen, and if they get very sick they need intensive care, and it's not unusual that they need invasive mechanical support, so a breathing tube in. And our aim was actually to reduce the need for respiratory support in intensive care. Paris 1 was the first of its own internationally, the biggest trial that looked into that type of question, and certainly has helped to change practice in these children.
With our studies, they are the first of their kind in such a large cohort of children. So we've got, well over 3,000 to 4,000 children. And there's other studies we've done, knowledge translation studies as well, that we've put the evidence into practice in different ways, shapes and forms. But they are the largest of their type in the world. And the Paris 2 study is specifically helping us know more in the less than 5 age group. So in the Paris 1 study, we did that up to 12 months of age with bronchiolitis. Paris 2, we looked at all respiratory illnesses, including bronchiolitis above 1 year of age, but it was all under the 5-8 year age group.
So the Paris 2 trial was now children older than 1 year of age, again with breathing problem. They can present with an asthma, they can present with a chest infection, can be viral or bacterial. And what happened after Paris 1 was that clinicians said, yeah, if it works in little ones, it will work as well in older ones. And there were quite a few studies out there as well in adults that showed that high flow is quite a good support method in adults. So clinicians started using high flow as well in the older children. And then we said, hold on, we really need to find out, does it really make a difference in older children? Yes or no? So in the Paris 2 trial, we again have enrolled a large amount of children with respiratory distress, but this time we couldn't demonstrate that the high flow was superior to standard oxygen.
The Paris 2 wasn't the outcome that we actually thought. It wasn't our hypothesis at all, so it did surprise us, but what it's done is made us actually turn it around and go, well, the benefits from it, we actually do know which children to use it on now, and we now know that it's sort of a stepping process of, start them on something less, so start them on standard oxygen and then start escalating them when you need. So it actually has taught us the right way that we should be using nasal high flow on these children.
Paris 2 is the world's first large randomized controlled trial investigating oxygen therapy using high flow in children aged between 1 and 5 years of age. We recruited 1,500 or a little bit more than 1,500 patients, and the trial is eagerly awaited by our colleagues on international level because there's no information yet how to use nasal high flow in that age group.
With the Paris 2 study, when this publication comes out, it will direct clinicians around the world to now know, okay, not every child under 5 requires high flow therapy from the very beginning, or depending on the severity of illness.
Clinicians obviously tried to do their best and use what they know from their experience. But as usual, you have 10 clinicians in one room, you have 10 different opinions. So the practice was all over the shop, all different ways to deliver oxygen. And Paris 1 was certainly one of the trials that basically delivered the best evidence that we have currently to support oxygenation in infants with bronchiolitis.
Paris 2 study has helped us know that it's not right for all children when they come in the door, but some children, when they escalate, yes, you can use it, and that will prevent you having to go to intensive care.
Yes, it certainly has changed practice. It not only has changed practice, it has changed the way we understand how oxygen needs to be delivered.
We really are leading the way in Australia, and we're about a decade ahead of the care that they do in America, in that they put a lot of these children in ICU in the cities, whereas we've already surpassed that.